Hello, everybody. Thanks for joining us in this webinar. I'm here with John Filardo, who's the Senior Vice President of the American Chiropractic Association, and we're here to discuss the Chiropractic Medicare Coverage Modernization Act of 2019, also known as HR 3654. Thanks for joining us, John. Really appreciate you being here.
Well, thanks for having me on this morning, Michael. It's my pleasure, and hope to dispense some good information that folks can use going forward. This is a very big deal, as you can well understand. I just was on the phone with a doctor from Florida, and we talked about this, and he told me this is the biggest thing since insurance. It's something that's well past overdue, and it's something that we aim to complete in the coming session of the U.S. House and the Senate.
So I guess let's go ahead and just start off with, like, what is HR 3654 for those who might not be familiar or have not heard of it yet?
Sure. It's simply a bill to allow patient access to the whole host of Medicare covered services that chiropractors are allowed to perform under their state licensure. This basically, it's a 2.5-page bill. It basically eliminates the restrictive language that chiropractors and their patients have been subject to since 1972. So all it does, it eliminates that restrictive language that has been in place for many decades now, and it just puts us on par with MDs and DOs, and as far as access and being able to perform Medicare covered services under your state licensure.
And so that restrictive language, because right now Medicare really only covers spinal manipulation. Being part of the Rehab Council, obviously there's a lot of people who perform rehab, and especially when we're looking at evidence-based practice. So that language, as part of this bill, that'll allow coverage for rehab services provided by chiropractors. And is that what this bill is basically doing?
Oh, sure. I mean, Medicare patients will be allowed to access, and again, chiropractors would be able to be reimbursed for all Medicare covered services allowed under their state licensure. For example, evaluation and management services that's a covered Medicare service, but is not does not apply to a chiropractor or chiropractic patient. Diagnostic imaging and post-therapy services, like you talk about, rehab services that are Medicare covered services, current Medicare covered services that you would be able to provide as long as they fit under your state scope, and again, are Medicare covered services.
That sounds massive, because I know examinations is obviously, there doesn't seem to be a good reason why we shouldn't be covered for those services, and so that seems like a massive part.
From what I understand, Michael, in that in every state, a patient comes in, there has to be a diagnosis. Why are you here? What brings you to me today? And that starts the entire evaluation and management process, which is a Medicare covered services, but just because you're a doctor of chiropractic, the patient has to either pay or you have to eat that part of the service. Again, you're absolutely correct. That is a huge part of this. And again, this would be corrected under HR 3654.
As I was kind of digging into what this bill actually is, it looks like in this bill they're redefining, or they're defining a doctor of chiropractic as a physician in the Medicare system. What does that specifically mean for those of us in practice right now? Because it doesn't seem like, by title we're a doctor of chiropractic, but what does it mean to actually be a physician in the Medicare system?
Well, we are labeled as physician right now in the Medicare system. However, like I've said before, it's under a one service only. It's the manual manipulation of the spine to correct a subluxation. That is the only thing that doctors of chiropractic can perform to for a Medicare patient. And what this does, again, takes away that restrictive language that I just talked about and puts DCs in the same category as MDs and DOs and gives us the ability to offer beneficiaries the full scope of services allowed under your state licensure, just like MDs and DOs currently can do, who are also labeled, of course, as physicians in Medicare, but we're labeled as physicians, but it's for one service only, and this bill would take away that restrictive language.
Does changing that restrictive language in the Medicare system, does that have implications for other parts of healthcare, such as private insurance?
Yeah, that's a very good question, and we all hear, how goes Medicare? How goes private insurance? So private insurance bases a lot of their policies and payments and so forth off the Medicare system. And so this will put chiropractors, again, on a level playing field in Medicare, and that over time, that should spill over into private insurance. I'm absolutely confident that that will happen. It may take a few years afterwards, but again, we all hear, how goes private insurance? They base it on the Medicare system, and now this bill will change all of that thought process as well.
It sounds great. I think that's definitely something that we need to change and work towards. So this bill's a great step in that right direction. What can chiropractors do to support HR 3654?
When you first told me about this question, I wrote down three things. First, go to www.hr3654.org and become familiar with all the information we've made available. Second, on that same web page, go to the Take Action tab and send an electronic message to your representative asking them to co-sponsor HR 3654. The more co-sponsors we have, the better the likelihood of our success. We envision this to be part of a larger Medicare bill sometime probably next year coming up in Congress. That's what we do. We don't want it as a standalone. We want it part of a much larger bill. And to have that happen, we need support from 200, 300 members of Congress that co-sponsor this and say, look, I support it. That will make it much easier for us to get that into a much larger legislative vehicle. Third, contact your state delegate. I know in Washington State, where you are, your state delegate is Dr. Gina Wolf, and coordinate a face-to-face meeting with your representative. Also, go back to that web page I told you about. Again, it's hr3654.org, and go to the resources tab we have there and look at all the resources we have that when you do meet with your representative or their staff, you are armed with the best ammunition possible regarding this bill. We've got a great document on there on cost savings that they always like to see, because I think one of the first questions they'll ask is, well, how much does this cost? We do not have an official, what they call here, score or cost estimate by the Congressional Budget Office, but you can say that, Congressman, Congresswoman, we have great information and great studies that show cost savings in chiropractic. And that's all there. That's all on that resources tab. And we've got talking points for when you go into an office. We've got leave behinds. One is our issue brief. Another one is that document I just told you about. And another one is a dear colleague. And a dear colleague letter is one that was sent out by the sponsors, Representative Higgins and Reed from New York, that goes to throughout the entire House and asks them to co-sponsor the bill. Leave that information behind, that dear colleague letter. They're all familiar with. They all know, what that is. So leave that behind as well. We've got that all on our site. I've got to give props to our communications team here at ACA. They put together a great page where you can go and become familiar with this bill, have the resources you need, and also to send that electronic message to your member of Congress. These electronic messages, they're the gold standard now. It's back in my day when I was on Capitol Hill, the gold standard was the written letter. Well, we've gotten past that. And the gold standard now are these electronic messages. It's a numbers game at this point, Michael. And what I mean by that is that the more messages that we get into our congressional offices, the more they're going to start to pay attention. And in those Monday morning meetings with the congressman or congresswoman, they're going to say, look, I've gotten 300 letters on this chiropractic bill. We've got to go on it. That's what changes their mind. That they see that there's support from their constituents back home. That's when they co-sponsor the bill. So we need that to happen.
I'll definitely put the link to that website so everyone has access to it, because I know I did the ACA form to send a letter to my Congress, and it was very easy. It took 10 seconds. The letter looked great, and it was already sent. So I think everyone in clinical practice has 10 seconds to spare, especially for something that has implications this large. It also sounds like not only should we as chiropractors do this, but a lot of our students, student chiropractors, they could be involved too, because this has large impacts for their future in practice. But not only that, but for our patients in practice as well right now, because eventually they'll get into the Medicare system, and a lot of times they have to face a choice of they can't have that same services by their chiropractor because they're not covered under Medicare anymore. So it seems that we should also let them know that this bill would actually help them transition when that time ever comes.
That you make an excellent point, and let me tell you, it's very important to get your patients involved. I was at a meeting late last year with the now chairman of the Ways and Means Committee, Congressman Richard Neal, up in his home area in Springfield, Massachusetts. And there was a patient in the room, and the patient made the point for this change better than any of the chiropractors in the room, better than I could make that message convey to the congressman. The patient was spot on. So yes, that's a great point. Get your patients involved in your office. We are making, and go back to this website, again, hr3654.org. Keep going back to it because we're updating it almost daily. And we're going to have also some material on there that is aimed to patients, aimed to doctors, that they can give to their patients to go to the website. And take them along. If you have a congressional meeting in their home district, take a patient or two along with you that feels very strongly about this issue. And you're right, most of them will. This patient that was in this meeting last year, he was, I think it was just about to turn 65, and the message was, Congressman, I've got these benefits now under my private insurance, but the day I turn 65, the day I go on Medicare, they become a ghost benefit. And he got it. He gets that. They got that. So yes, make your patients aware, make them involved, and make them informed on this entire issue.
I think that's all really good advice. So thank you so much for taking the time. I know you're very busy up on Capitol Hill and advocating for everything as part of the ACA and on behalf of all the chiropractors like me in private practice. So really appreciate it. Everyone should go to the website, get educated on the bill, spread awareness. If you know a colleague that's, in your local community, make sure to reach out and let them know. So that way we can put a lot of support behind this bill. So thank you again, John. Appreciate you taking the time on this call.
Doctor, thank you for initiating this. And, you know, I put this out to anybody listening. Please contact us here at ACA if you need any of these resources or have a question about any of these resources. Contact us here at ACA, and I can tell you, we are here to help you get this bill across the goal line. That is our absolute goal right now, is to make this bill a law, to make it reality, and have our patients be able to access these wonderful and essential services that you provide.